So it is 3 o'clock. I believe that we can get started now. And you all probably remember how this goes. Any Codi member may call the meeting to order at the appropriate time, which would be now. If anybody would like to do that.
All right.
Do we need to find out if we have a quorum?
Not until we call to order, and then we have to elect a chair pro temporum.
Give me one
Okay.
second.
Yeah.
I think we should call this meeting to an order.
Okay, thank you, Matheson. All right. So Matheson, you will temporarily preside while the members elect a chair pro tempore to do this meeting. There is no quorum required to elect a chair.
Yeah, I'll try again. Give me one second. Okay, sorry, that wasn't me, but I'll do it anyway.
What are you doing, Maddie?
I said, sorry, that wasn't me that spoke up, but I'll do it anyway.
Okay, so you nominate yourself for chair.
Yeah, it was me mumbling. I wasn't talking very clearly. So
All right. Do we
Sorry,
have
I'm
a
Zoom
second
meeting.
for Maddie Matheson being chair?
I second
I'll
that.
second it. Yep, we got 2 seconds. John, you went first.
Yeah, we're in agreement.
Thank you, Simmons. And may I get all members that are in favor of this to
Since you're
say
not in,
aye?
let me see if that works.
Aye.
Hey,
If not, I'll have to figure it out.
All right. Any opposed? All right, Matheson, you are chair for this meeting. Now we need to elect a
You're
secretary
private.
for this meeting.
SCXO.
This is Spangler. I will volunteer for secretary since I am anyway.
Thank you, Spangler. I appreciate that.
No problem.
Put SCXO 2299.
Do I have a second for Spangler being secretary?
I second that. Eldridge.
All right.
Thank you, Eldridge.
Let me just delete that one.
This is Cook. Could we please mute our devices if we aren't speaking currently, please? It's a little confusing. I'm hearing some background noise.
Thank you.
Thank you all.
Everybody in favor, please either say aye or raise your hand.
Aye.
Aye.
Okay.
All right.
Any opposed to Spangler becoming secretary for this meeting? Okay, motion passes. The chair pro temp for this meeting is Matheson and the secretary will be Spangler. So next, Matheson, is a motion to adjourn. We need the motion, we need the second, all in favor and any opposed.
Okay, so we're calling for a motion to adjourn.
Mm-hmm.
May I
That's
have a
why.
second, please?
Why do we adjourn? Because there's not a quorum.
Oh, you know what? I am so sorry about that.
About to say, didn't we just start this thing?
I need to do a roll call first. We might have quorum today. And if so, we don't need to adjourn. So let me do a roll call real quick and then we shall see. All right, Brooks. Okay. Kane.
Here.
Thank you. Eldridge.
Here.
Thank you. Maxwell. Matheson.
Present.
Thank you. Mull. Simmons.
Here.
Thank you. Spangler
Here.
and Ziegler.
Here.
Thank you. 6. This is amazing. We have 6 out of 9 members present. We actually do have quorum for today. So that would mean that we do not need to adjourn and we can approve September, October, November, and December minutes.
I approve.
Okay. So with roll call finished, I guess we'll go ahead and do the September minutes.
Those that are able to motion and second to approve September minutes, include Kane, Eldridge, Maxwell, Matheson, Mall, Spangler, and Ziegler.
Is Eldridge,
Okay.
motion to approve.
Motion to approve. All those that were there that are in favor of approving of the minutes, say aye or raise your hand.
Well, we need a second.
Oh, you need a second? I'll second.
Thank you, Matheson.
Now, all in favor, either say yes or raise your hand, please, for Misha.
Aye.
Yes,
Aye.
Any opposed? The ayes have it. We'll
Thank
move on to the October minutes. Can I
All
get a
right.
motion to accept that?
Those that can actually motion or second include Kane, Eldridge, Spangler, and Ziegler for October.
Okay, of those mentioned, can I get a
Aye.
motion to accept that one, please?
Eldridge, accept.
A second, please.
This is Ziegler. I'll second.
All right, and all those that are able to, please say aye.
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 Any opposed? All righty, the ayes have it. November.
All right, for November, those that can motion or second are Brooks, Eldridge, Simmons, and Ziegler.
I'd like to make a motion to accept the minutes.
Thank you,
All
Simmons.
Have a motion. Do we have a second?
This is Ziegler. I will second.
All righty. Of those mentioned, all in favor, please say aye or raise your hand.
Aye.
Aye.
Any opposed? All righty, the ayes have it.
All right, for December minutes, the only two people that can motion or second are Brooks and Eldridge. And Brooks is actually not here today. So we will have to push December's approval till the next time we have quorum.
Okay, so we will push that to the February meeting.
Yeah.
Roger that.
All right. Thank you all. Next up, Maddie, I'm not sure if you have the agenda pulled up or not. So I'm going to go ahead and step in and introduce Linda Johnson from the Alzheimer's Tennessee. She is the director of programs there, and I'm very excited she's here today. We've been going back and forth for just a little bit trying to get this set up.
Sorry. Are you ready for me, Misha, to start? Or no?
Absolutely.
And you
Thank
you
for
can
being
hear
here.
me. You can hear me.
Yes.
Thank you. I apologize. I'm not very technical and I'm working from home today because I'm a little under the weather, but I refuse to cancel on you. So you'll have to just give me a little get out of the jail card today. So I did send over a sheet with all of our kind of pertinent information about Alzheimer's Tennessee. We were created in 1983 by a group of professionals and family members who wanted to bring awareness to Alzheimer's disease and support for families who were living with Alzheimer's. And over the past 40 plus years, we have did that. We have kind of gone on the journey with family members as from the time of diagnosis to usually at death. And we don't always have an answer for families, but what we try to do is find resources outside of our organization to help families be able to live with this very challenging disease. We have a 24-hour, 7-day-a-week helpline. And on the handout, it does have that number on there also that families can call. My director and I get an email immediately when families call this number after hours. And we look at the email, and if it is a real emergency, we call at that time. If not, we call the next working day. And we really take that important because sometimes it is a real emergency for families and they don't know which way to turn. So we try to be there for that. We offer caring and coping caregiver conferences across the state. We have 6 regional offices, including Knoxville, and an adult day program that is housed in a church in downtown Knoxville. We've been in existence with the daycare since 2007. We are licensed for 16 individuals at one time. We have financial assistance for that. We try not to turn anyone away because of a lack of payment. We have some reserve funds that we use for families who may be financially in need and cannot afford a adult day program. We do a research disease management symposium once a year. I don't know if anyone on here has ever attended it, in Maryville College. And we bring in professionals, healthcare professionals across the country to talk about updates on Alzheimer's and strategies for families living with this disease. In-service trainings, we do those for agencies and facilities and communities. We train nursing home staff, we train assisted living staff, adult day programs. We've trained Sunday schools. So we, again, try not to say no to individuals or organizations that need just some research or advocacy or just want to know more about Alzheimer's disease. We train first responders. We've been very successful with that, with law enforcement and EMTs. They a lot of times come in contact with that person who has been maybe sometimes not officially diagnosed. And so we have become friends with them, and they will call us and give us the information and say, I pull this individual over and there seemed to be a problem. Can you help me reach out to the family just to be able to guide them? And we have been able to help families by getting them an assessment and a diagnosis. So we do work closely with families with that. We have support groups that meet across the state, virtually and in person. And during COVID, it was a real challenge for us because we did not have experience with doing things virtually, but the stars aligned and it has worked out beautifully with us. Some individuals still need the contact of being in-person support groups, so we offer both. We offer both. We have a new group that we're very, very proud of, and it's called Memory Cafe, and I think it should be on the handout also. And it's individuals who have been diagnosed in the early stages of the disease. And they have decided that this is not going to be a death notice at this time. Some are still driving, some are still working. They meet about 2 to 3 times a week virtually, get together and kind of support each other, advocate for each other. Maybe once a month they get together and go to plays. They may go to the movie. They may just meet for coffee, but all that is part of living with the disease. And it's our job is to kind of make that happen for them. So we're very, very proud of that program. I don't know if many of you have heard about Silver Alert. We were very involved with getting that passed in law, and we're very proud of that. We have packets in our office. We are trying to educate and sign every individual that may have a tendency to wonder, trying to get them this packet. We don't charge for the packet. You can call our office, we can mail it to you, or you can come by and pick it up. We also try to help if it's a elderly family and they can't get like a recent picture and can't get the paperwork filled out. Our staff is ready to help do that for individuals. Any questions for me? I don't want to do all the talking. Does anyone have any questions for me or comments about anything?
Somebody want to recognize Stephanie Cook?
I couldn't get my cursor over to my audio button to unmute myself. Doggone it. Linda, thank you for sharing when you're not feeling well. Bless you for being here.
Thank you.
And second of all, I'm extremely intrigued. Alzheimer's is very personal to me, and my mother has it, and she lives with my husband and I. But I work for the city. I'm the Americans with Disabilities Act coordinator. And what you said about you working with law enforcement really piqued my interest, because we do training on interacting with individuals with disabilities. And I know they have a great program to work with individuals who may be on the autism spectrum.
Mhm.
You know, should they wander, and we can hopefully get them back safely and that kind of thing. So my question is, have you ever been invited to come to a training academy, you know, like on an annual basis? Because I'm thinking I might want you to join us in some of our ADA trainings with the law enforcement.
Actually, we have a program called Virtual Dementia Tour. And
Okay.
and what that program is, it's a simulation of what it is in the life of a person with Alzheimer's. The complete process takes about 15 to 20 minutes. We distort your hearing, not to the point where it's not scary. I promise you, it's not. We won't hurt you. We distort your vision. We kind of show you what it is to have arthritis, how processing comes into effect with that. So we do that for law enforcement also, and we're happy to. We don't charge for that. That's one of the things about Alzheimer's Tennessee. We do a lot of fundraising, but we try to put all of our funds back into giving to the community. So we don't charge for that. And I said all that to say, yes, Stephanie, we would be happy to do that with you. Thank you.
Perfect. Thank you. I will be in touch with you.
Okay, you're welcome. We also present a program, everyone is not diagnosed, and we did a presentation last month or November at O'Connor Center because everyone is not diagnosed. So people are wanting to know more and more about brain health. So we have a program that we present of brain health for individuals. And it's that question about Alzheimer's is, why is it that someone at 60 is diagnosed, but then I know someone who's 99 and is clear as a bell? So we feel like we need to offer that part of the disease also, and we try to do that.
Thank you, Linda. Does
You're
anyone
welcome.
have any questions for her?
This is Simmons. I had heard, and I don't know which way it goes, but is Alzheimer's a version of dementia, or dementia a version of, I think somehow the two seem to be correlate. I know there's tests that prove them different, but I've heard something, and it's kind of difficult to know which one's a version of which.
The dementia is first. Dementia is the big umbrella, and under the big umbrella is it's probably 100 different dementias. Alzheimer's, for whatever reason, seems to be the most common that you hear about. So yes, and we get helpline calls, and someone will say, now my mother, she does not have Alzheimer's, she has dementia. So you have to first do that education part with families too. So you said it right, Simmons. So yay for you. If I was in person, I would give you a gift, but I don't, but I'll send it to you. Okay.
You're on mute, Simmons. Simmons, you're on mute.
We can't hear you.
Hey,
Yeah,
Joel, you're on mute.
I had, yeah, I got it. After I looked down, I said, yeah, I've gotten in a couple of debates about that. They're like, no, they're completely different. I'm like, I don't know about that, but
Yeah,
I've been wrong so many times in my life. I just accept it and move
well,
on.
you were right that time, and in a good way of
That's the blind squirrel in
explaining
the
that.
nut thing.
Yes. Yes.
Thank
And
you.
it's individuals who are wanting to know. People really do it. One time it seemed like it was, and it still is scary, but now people really want to know, and they want to know early. I tell this story all the time. Our office was one of the few people that knew about Pat Summitt's diagnosis kind of probably 24 hours before they went public. And so we prepared to keep our helpline open longer that day, and the calls were coming in until like midnight, and it was individuals who were worried about themselves, not necessarily someone else, but they wanted to know what they could do for brain health. So that's when we decided that we owed it to people who are not diagnosed also, and how to possibly get around this. So we take that very seriously.
All righty. Thank you very much, ma'am. I believe
Thank you.
next we have Mr. Strand. Who will be speaking? Hi, if you wouldn't mind coming off mute, and you have the floor, sir.
Wonderful. Thank you. My name is Jeff Strain. I'm the Director of Public Policy for the Tennessee Disability Coalition. We're an organization of almost 40 now agencies and allies that come together to work for good public policy for people with disabilities. And I'm here today to talk about our annual scorecard. So this is the third year of our scorecard. The idea behind the scorecard is to kind of paint a picture of what it's like to live with a disability in the state of Tennessee. We have 9 categories this year, from family caregiving support to access to care, transportation, employment, education, kind of the spectrum of what it means to just be living in the state of Tennessee. And I was going to try to highlight a couple things, but I'd also be just very interested in hearing if folks had an area of interest or were interested in kind of hearing what we're planning to utilize our scorecard for. So I guess I'll start there. One of the big goals of our scorecard is to not just highlight problems and kind of portray the landscape of living with a disability, but also to utilize those problems to develop policy solutions and build up support for those policy solutions. So 2023, 2 scorecards ago, we introduced this idea of homework because the state of Tennessee had bad grades and continues to have bad grades. But we think, just giving someone an F doesn't really teach them anything new. You got to give them homework so that they can practice and improve upon their grade. So we added in 3 policy components for each of our sections to see what the state would do, kind of. And to our great surprise, they did a bunch of them. So I think we proposed 21 different policies or investments or changes to the law that we thought would positively impact the Tennessee disability community. And they did 10 of them. And so that's between, let's see. So the first one here in family caregiving support, they passed a joint resolution urging the state to set up a paid family caregiving program. They made several investments in their final budget. They created a new Department of Disability and Aging, DDA. So they did a number of these things. And we were really excited about that because that meant that it was having the impact with the right people that we wanted it to have an impact on. And those are our decision makers, both the General Assembly, but the governor's office as well, TennCare, Department of Disability and Aging, Department of Health, a whole of government idea. And so in 2023, we reduced the state's grade to a D. And then this year, when we took a look at that, we said, well, they accomplished 10 of the things we asked them to accomplish, but they also went backwards a little bit. So we added this idea of demerits just to continue to play out this metaphor as much as we possibly could, and highlighted some of the demerits. And when we looked at whether or not the experience of living with a disability in the state of Tennessee had changed substantially enough that we could improve the grade, we decided that it hadn't. And we thought it would be a disservice to our community to say that even though we did these things, they've improved their grade. So this year, again, the state gets a D. And a couple of the categories that I want to highlight are related to homework for this coming session. This is the 2024 scorecard. And as we start the General Assembly session a week from yesterday, we wanted to put those policies forward because they're things that we're going to be working on. So one of our big ones this year is family caregiving support. It has had I think we gave it an F- in 2023. We're making up grades. It's so bad. But looking at what the state did, they just didn't act with the appropriate level of urgency. AARP ranked Tennessee 51st out of 51 in the amount and quality of support that we give family caregivers. And it shows in the experience of family caregivers. Some of the stats that we use to kind of justify this grade, 20% of family caregivers in Tennessee report that half of their days every month are poor mental health days. And that is something that, we can kind of anecdotally hear from caregivers that it's really psychologically taxing to be a full-time caregiver all the time, every day, 365 days a year. But that really highlights that a full fifth every other day is a bad mental health day. We rank 45th nationally in availability of home health care workers. So that's indicating that a majority of this responsibility is falling on family caregivers rather than a formal paid workforce. And AARP, our other one, 51st out of 51. So we've been kind of building at this piece of legislation that we want to introduce this year for a couple of years now. And this is going to be part one of two parts. And it's to establish a comprehensive statewide paid family caregiving policy and program. It's our phrase. But this is going to be a part one. We think that this is a good way to talk about the issue, help people right now, and get the momentum moving towards a more comprehensive plan. This year, we just want to tell TennCare that they cannot discriminate or they cannot create discriminatory policies that target family caregivers, which would prohibit a provider agency from hiring them as an employee. So they can hire a provider agency who hires DSPs and sends them out to do home health work, can hire anybody that they want, except a family caregiver. We find that to be, gallingly discriminatory. And so what part one does here is it explicitly states that you cannot create discriminatory policies for hiring for Medicaid-involved provider agencies. And you need to create, a guidebook. You have to tell provider agencies that, yes, they're allowed to do it, and here's how you do it. And we think that this will have, for some, an important impact. There are a lot of folks out there who are not getting the services they're providing or have been promised, and so their family members are stepping up. And they're not getting paid in the way that anybody else would get paid to do those things that have been promised by the state. So we think that this not just offers from financial flexibility, but it also kind of opens the door to something bigger. So that's part one. And then next year, part two, is this kind of upskilling and credentialing component that makes it much more comprehensive. So people who are providing these family caregiving service, they're not always personal assistance services, helping people in and out of bed or transporting them in a car kind of thing. Others are more complex nursing tasks, like feeding tubes and ventilators and things like that. And so those are valuable skills, right? That parents, essentially taught themselves and do on a day-to-day basis because the state's not sending anybody to help them. And so what this would do is, and because those are more difficult skills, more require a different set of training, those get paid higher. Or people who can do those are paid better at a provider agency. What this would do, this part two, would be to either upskill those family caregivers, teach them how to do these things, or help them test out. So to be able to go to like your local TCAD and say, hey, can I test out of, a feeding tube, operating a feeding tube. And then once you can do that, your provider agency can pay you more. So we think that there's this good combination of right now, this year, we're going to knock down all the barriers and open it up for people for whom this works. And then next year, we want to support them better. And that's the comprehensive part. We did some focus groups last year, and one of the things that people told us, family caregivers told us, was that they want support. They want support from the state. They want to feel like someone's got their back, that they're not in it alone. And we think that part two really accomplishes that part of the comprehensiveness for us. And please, if anybody has questions or thoughts or comments, feel free to interrupt me. Otherwise, I'm just going to ramble faster and faster as we keep going.
This is Simmons. I got a couple of quick ones for you.
Yeah.
I know you're talking about you're giving grades, you're giving homework. I'm curious, is there a state in which you'd like, if we wanted to be like what state, is there a state you're looking at? And what is it they like about that versus our obviously failing system?
Well, I think one of the things, to Tennessee's credit, and I'm loath to give Tennessee credit about many things, but to Tennessee's credit, or to their defense, lots of states struggle with these exact same things. If we're talking about specifically family caregiving, what is it? New Jersey, the mid-Atlantic, like New Jersey, Delaware, Connecticut, all do a pretty good job with this. Colorado does a pretty good job. And I know that those are not states for whom Tennessee legislators would like ours to be compared. But those are the ones that do a good job. If I could hire a little minion to work on this with me, we would do a 50-state survey because we can grade kind of on these arbitrary data points, but in comparison, I think you create a more persuasive piece.
And one more quick one on family caregiving. It's if they don't live in your house, you can hire and pay them through some of the Medicaid stuff. But if they live in your household, you can't. Doing the same work, but yeah, I'm like with you on that one. I'd like to see them come in and go, well, wait a second, we'll pay them if they don't live at the same house. But yeah, I don't know. It's redunculous in some things.
Yeah, and there was a piece of legislation passed by Representative Parkinson and Senator Briggs last year that intended to do away with that residential part, but it was amended by our good friends at TennCare in such a way that now you can live together, but if you live together and are related, you can't. So it sort of like flipped it around, and I don't need to tell you all that TennCare is brilliant in the legal department, but it's what they spend their time doing. This one I'm really excited about, but it's super boring to everybody else that I've told it about. But I think that this lays the groundwork for some substantial change that we can accomplish in the TennCare Medicaid system. This is the category of access to care for which the state also received an F. We rank dead last in Medicaid spending per enrollee by like $1,000. Like it's not even close to number 50. I think we spend about $3,400 an enrollee, which is a gallingly low amount. And then we call it shared savings when we dump it back in for political purposes. But sorry, it's the beginning of the session here, so I've got my cynicism hat on, so forgive me. Currently, the reimbursement rates for hospitals only pay about 75 cents on the dollar for every dollar that a hospital spends on a Medicaid enrollee. And 44% of enrollees in the ECF Choices waiver, the program for people with intellectual and developmental disabilities in the state, 44% of those who are enrolled say they're waiting for services that have never arrived. And so access to care, F, nobody's getting what we're promising them. And one reason that TennCare can get away with this is because of the way that they report their network adequacy. How many doctors, specialists, DSPs are available to provide the services that they're promising? And they call that their provider network. And currently, as the feds tell us, all you have to do is have a provider participating in the program within a certain time and distance of an enrollee, right? And it varies for what kind of provider, but it's somewhere in the range of like 30 to 45 minutes or 20 to 45 miles. And what that does is it obscures the fact that many providers that are enrolled in the Medicaid program aren't taking new clients. They're not, or it takes you 18 months to get there. You're not getting any services if you can't go to the provider or the provider can't come to you. And so TennCare has no incentive to change how they report or improve on their provider network because time and distance says that it's just fine. They have this totally incomprehensible report, but if you page through that, they have table after table after table saying that they are 97, 98, 99, 100% coverage for specialties across the state. And we just know that that's not true because we hear it every day. And so what this does is it flips it around from that supply side, how many providers are there, to the demand side, what are people actually getting? And this is modeled off of the pending home and community-based services access rule that was just finalized by CMS this summer, except that it gives Tennessee and all state Medicaid agencies 4 years to roll this out, which means that 5 years till you get data and 6 years till you can do anything about it. And we think that that's too long. And we think we want to know some more stuff. So what this does is it changes the provider reporting from that supply side to demand side, saying, what percent of services are you promised versus what are you getting? How long is a wait time for an appointment? And how long between approval for a given service and receipt of that service? And so we think that that is a much better depiction of the density of a provider network than the supply side. And we think that that doesn't solve anything, but I think it lays the groundwork to forcing TennCare's hand. That if we're able to go to the General Assembly and say that people enrolled in ECF choices are getting only 20% of the personal care assistance that your state, the General Assembly, have promised them, I think they'll see that to be a problem. And unfortunately, they're going to recognize shared savings for what it is. That's where our shared savings comes from. We're also asking in this piece of legislation that we break down those numbers by county, by waiver program, and by some demographic information like age, gender, race type of thing. And so I think that really identifies where the gaps are in the TennCare system. And TennCare very well might know those gaps, but we don't know those gaps, and we would like to tell people about them. So I don't know if that's exciting to anybody else, but that one's exciting to me.
No, as Elder, I agree. Demand side is much more relevant than the supply side. Has no, oh yeah, supply side means very little.
Yeah, yep. And so those are our two probably big priorities this year. We've got 8 bills that we're planning to run this year, some of which could, be considered a 2-year project, but those are the two that I'm really excited about because those are the two that I think make the most short and long-term difference of our slate. Another one I'm excited about in the access to care space is reconvening of the TennCare Oversight Committee. So if anybody's had the great unfortune of watching Tennessee budget hearings, TennCare gets up every year and talks about, they bring out this graph that shows what percent of the budget, state budget, the TennCare was taking up. And it got up to like 41% or something like that, which is, admittedly probably too much. But then it goes down, 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 down. And they're like, look at how great we are at saving money now. Well, one of the causes of that downward trend in percent of state budget was the use of the TennCare Oversight Committee, which was essentially it was a General Assembly committee that was responsible for ensuring that TennCare wasn't costing too much money. And as you can see, they were highly effective at it now that we are the ranked dead last in the amount of money that we spend on a Medicaid enrollee. But we would like to see it reconvened to evaluate a couple other things like the provider network or the use of third-party vendors or the quality of service delivery. We think it could be an avenue of redress for issues with TennCare's customer service that they're unwilling to address otherwise. Because we go to them all the time and say, hey, this person told us this thing. And they say, don't worry about it. But if we go to a General Assembly person, they're less likely to say, don't worry about it. So this is one that we sort of have to throw out into the wind and cross our fingers because the only way that this exists is through an agreement between Speaker Cameron Sexton on the House side, Speaker Randy McNally on the Senate side. They have to decide that they want a joint committee and as they create the rules package next week, include that as their kind of committee slate. From what I hear, though, is they're both open to the idea. It sounds like Randy McNally needs a little bit more convincing, but, fingers crossed. Housing, and please stop me whenever I am out of time because I'll keep talking. Housing, another F. We're at 3 Fs so far. We've been running this data every year to see where it is affordable for people to live if they have a disability. We worked with a professor, a health economist from UT Knoxville, who studied how much extra it costs to live with a disability to achieve the same standard of living. He found nationwide it was 27% more income to achieve the same standard of living as someone without a disability. He found in Tennessee 51% more income. So you have to earn 151% of your neighbor's income to achieve the same standard of living. And part of that is because we just don't have the kind of supports and services that can mitigate some of those costs, but also we just live in a low service state, which means that things tend to cost a little bit more like that. So let's see, in 2022, there were 15 counties where someone making the median wage could buy the median priced house if you have a disability. without being housing cost burdened or spending more than a third of your income. 2022 was 15, 2023 it was 5, this year 2024 it was 0. There are 0 counties in the state accounting for the extra cost of living with a disability where someone earning the median income can buy the median house. And that is sad. That's another one, though, where we look at it and say it's a housing crisis nationwide. It's a housing crisis for people with and without disabilities. But we know that Carol, our former executive director, but founder, always says that people with disabilities are canaries in the coal mine, that whenever we experience an issue, it's either magnified for us and existent for everybody, or it's coming for everybody else. And it's an important role we play. But there are ways that we can improve upon our housing. So one of the things that they did last year that we had suggested in the scorecard was they removed this prohibition on inclusionary zoning policies. So Nashville in 2018 threw this policy out there that said, hey, if you want, you can participate if you want, and you're a developer, if you're building an apartment, you can have some zoning exemptions. You can build it higher, you can have fewer parking spots or whatever, if you include a certain percentage of affordable housing in it. And the General Assembly didn't like that, so they banned it. And our suggestion was unban it, because not only does that create an affordable unit of housing, but you can also incentivize accessibility utilizing a tool like that. And so they got rid of it. So we have some hopes, but housing is proving to be a big problem in the disability policy space. There's just not enough. There's not enough, and especially for those with high acuity needs, people with ID or developmental disabilities, especially those who have behavioral health needs, there is no place for them to live. And so last year at the General Assembly, there was sort of a big blow up about whether or not you can create larger scale residential facilities for people with disabilities. We have some laws that were put in place when the institutions closed to prevent them from opening back up. And people are willing to make exceptions to that anti-institutionalization laws now, because this is such an issue and there are so few solutions on the table. So that one's been an F all 3 years, and we can see the data showing us that it's trending in the wrong direction. Education, first non-F, this one's a D, so technically passing. But we published at the Disability Coalition white paper this summer about the education of students with behavior needs. We took a look at all the data and said, you know, IDEA and special education work really, really well for like 90% of kids with disabilities, but this 10% kids who have behavior needs, it's not working at all for. And so we really dove into what that looks like, what some of the root causes are. And one of the most surprising root causes that we found were teachers don't know how. And they say that. It's 59% of teachers, according to the 2023 educator survey, say they don't know how to support behavioral success for students in their classroom. That 59% don't know that. And we think that that's a problem, especially for this group of kids that are, you know, sort of bluntly failing, and our school system is failing them. And so what this piece of legislation that we're proposing would create what's called an academic and behavioral specialist license. Essentially, it is teachers to teach students with behavior needs. Okay, great, gotcha, got it, 15 minutes. And it's modeled after, it's actually my teacher's license in Minnesota, where we spent about half of our teacher prep program learning how to do behavior interventions, how to create a behavior intervention plan and use a functional behavior assessment, and how to build systems that can accommodate behavior needs, and then how to work on an individual basis with those kiddos. And so I'm excited about that. Had a good meeting with the State Board of Education yesterday, who are supportive of this idea. And so I'm excited to see that one go forward. I just want to point out that one of the pieces of homework that received a gold star from us that they accomplished from the 2023 was the lowest bar possible, and it was accept federal funding for special education. 2 falls ago, it got floated out there that maybe the state wasn't going to accept $1.8 billion from the federal government. most of which goes to pay for special education. And so our homework was just accept it. And lo and behold, they did. Another one that we want to begin to further shift our focus toward is the category of aging. And so this year we gave aging a C+, in part because the state and the budget reflected some urgency for kind of the first time that we had noticed in the process of the scorecard. But we still see that Tennessee has the 10th highest poverty rate among seniors. 44% of Tennessee renters who are 65 or older are housing cost burden, meaning they're spending way too much of their often fixed income on their housing. And we rank 37th in the percent of residents 65 plus who receive SNAP benefits. And normally you'd say that's a good thing. You know, we don't want people to qualify for food assistance because they're so poor, but we know that we're the 10th highest poverty rate. So there's this disconnect between connecting people 65 plus living in poverty and services that can support them. And so we think that that is problematic. And so one of the big ones that I'm excited to see this year is a budget request, and it's to draw down the waiting list for the options program, which is a non-Medicaid program, and to draw down the Choices Group 3 waiting list, which is for folks who are at risk of potential nursing home level of care. And opening up Group 3 is such a fantastic investment because it keeps them out of Group 2 and Group 1, which are people who qualify for nursing home level care or are in a nursing home, which is way more expensive. And so for years, the state has kept Group 3 closed for reasons unknown. I mean, it's like preventative maintenance. It's like brushing your teeth. It's making sure that you are putting off the worst impacts of aging farther and farther down the line. And so we really think it's important that the state spend money to ensure that Group 3 is accessible and it works, because we know it works. There was a study conducted by the state. They said this is why they closed it, so they could do this study. I don't buy it, but they did a study over the last 3 years that found something like 250% return on investment for every dollar spent in Choices Group 3. And so there is a budget request in this year to draw down the waiting list for Choices Group 3, but we'll see. But it is one of those ones. They elevated the Tennessee Commission on Aging and Disability, combined it with the Department of Intellectual and Developmental Disability to create the Department of Disability and Aging. That was a piece of homework that we had suggested last year. We think that that's a good opportunity to best utilize the resources available for both, and it elevates aging as an issue and something that the state is responsible for addressing into a cabinet level position. So we're excited about that one, and excited to see a grade that is it's almost a B. We'll see what they do this year. They could get up in the B range. Mental health access. This was one where so D-. This was one where we had to add an extra statistic to it because I couldn't decide which was more emblematic of a D-. So we ranked 46th in the availability of trained licensed mental health providers, 46th. I don't know if you're catching on a trend here about where our rankings tend to fall. We're ranked 38th in the number of psychiatric beds per 100,000 residents, 40th in the percent of adults with mental health need who are insured. So that's about the only way that you can get any mental health support is if you have insurance. And ranked 39th in the percent of youth with major depression who received care at only 62%. So that means that 38% of kids with major depression received no care for it. And so there's one here that I wanted to highlight that we're not running this year, but that's because it's complicated and I don't get it yet. But I like the concept. It's streamlining the ability of Tennessee school districts to charge TennCare for services that go to an enrollee. So currently, a district, if they have a student who is in, say, the Codi Beckett program, meaning that probably have either a complex medical condition or an intellectual developmental disability, they have at their disposal, sometimes $15,000 worth of home and community-based services that often get spent on a therapy. Well, schools provide therapies, and they provide them separate of TennCare. And it's really difficult for that district to bill TennCare for a service that's found in their person-centered plan. What they have to do is they have to go out and find an MCO. And I know everybody here loves chatting on the phone with like United Healthcare or Blue Cross Blue Shield, or talking to your insurance company. It's a great time all the time. They have to go and find an MCO, the MCO of the child who's in the school, and then create a contract with them that says that they can bill TennCare. So then if a service is provided, then the school who has the contract reaches out to the MCO. The MCO says, well, maybe I don't know if we provided medical necessity documentation or we have prior authorization. Then they go to TennCare, who maybe sends a check down their way. They take their cut off the top, and then they send the check on over to the school. It's just a clunky, complicated process. And that means that only 39 districts in the state have a contract with an MCO. So that is less than a third. And we think that this is an untapped resource for a resource-starved public school system, especially by reason that we have so much in shared savings. We remitted, last I heard, $1.1 billion that was supposed to be spent on Medicaid enrollees last year. We got about $330 million of it back in shared savings, but the rest just into the ether. So we'd like to work on that one next year, but we have to work a little bit more closely with the Department of Ed and unfortunately TennCare to figure out how exactly that can work. Employment's always a difficult one because as much as the state wants to say that we're an employment first state and everybody's expected, they have the expect employment report and everything. It's often not for everybody. It's got to be part of someone's life choices that they want to be employed. And then we need to provide the right type of services to allow them to pursue a job that they want. And it is valuable to them. One of our biggest wins last year was in this space. It was a Medicaid buy-in program that we were able to pass last year. We're really excited about it, and that's why their employment's up to a C- this year. But we want to see them build on that. And I think that that's building in the support part of this. So for many years, our vocational rehabilitation system had been sending money back to the federal government because we didn't want to match it as a state. And it was upwards of $25 million for 3 straight years running. Well, they finally spent it all last year, which means we get the same amount this year. But we don't spend very much on the actual job training component. It's difficult to say where a lot of it goes to. A lot of it goes to paying for college tuitions and assistive technology and things like that. But the job training part, the preparing people to be successful in a job that they want to do, we rank dead last in the country in spending on that. And I think that that's a place where we can improve that. One of the things that we hear a lot from caregivers and parents of kids with disabilities who are kind of entering the workplace, young adults, is that TennCare has a policy of automatic job fading or job coaching fading. So if you get a job coaching, a person-centered plan, you go work at Target and it's going really well. Once it starts going well, they start to pull back that trainer or that coach or that support person, even when, in some cases it's appropriate, but an automatic policy means that in other cases where it's inappropriate, it happens. So you go through this cycle of success and failure that really doesn't support anybody in having a job. So one of our pieces of homework this year is to end that policy, like formally end it, and ensure that people's job coaching is there when they need it and can be faded when it's appropriate. Probably got time for one more here. Access to justice is a new category this year. We see sort of a concerning reversion happening with the General Assembly towards more institutional types of settings. We see that in the residential space. We see that in the mental health space. We see things just being made felonies or made crimes for often political points. And one of the ones that was most problematic to us last year, well, 2 of them were very problematic to us last year. One was called Jillian's Law, It was a very tragic story. I'm sure you all heard. A Belmont student was hit by a stray bullet and killed by, it was shot by a young man who had an intellectual disability, and they weren't allowed to send him to jail. But what Jillian's law does is it assumes that a person with an intellectual disability is automatically a threat to their community, which means that unless they can prove that they're not, which is, I don't know how you prove you're not a threat, you can be institutionalized indefinitely. There's another option that you can be under court monitored home and community-based services and therapies. But as I'm sure, and as we've discussed, we don't have the network. We don't have the providers for that. So that means that this person's going to end up in jail or an institution or something similar to that. Second one that's really concerning from last year is a threats of mass violence law, that if anybody makes a threat towards a school, they can be charged with a felony. And that is wrapping its clause around kids with disabilities in a way that I'm sure wasn't intended. And so the ostensible goal of that was to eliminate threats or reduce these threats. Well, last I heard, we were well over 1,000 cases under this new law, which means it's not happening. There was a really tragic case out of Hamilton County where it was a young man with autism who denied making a threat and was told he could come to school the next day, went to a family birthday party at a Longhorn Steakhouse, and the police showed up and arrested him right then and there in the parking lot, put him in handcuffs and brought him to jail. And we think that that served nobody. It did not prevent a threat. It traumatized this child, and it created this environment where teachers and administrators are fearful that they can face discipline for not automatically, complying with this law. So we want to this year put in a couple protections on that latter one. Jillian's law is harder to work on. That had a lot of kind of political force around it. But we think that there's room in the threats of mass violence law to put some protections in for kids with disabilities and offer some discretion to teachers and administrators to consider the impact of a disability before they call the cops. And then the last one, this one's always hard too. Transportation, C-. It's not great, but a lot of that is vibes. It's really hard to find statistics on transportation, but that one continues to be an area of high interest for the disability community, but it's a difficult one to work on. So we've got a couple ideas here. Out of California, they're working on ensuring that rideshare companies offer accessible rides. And so incentivizing rideshare platforms to do so, or penalizing them if they don't, because it's the law. Or the same issue with service animals, making sure that people who have a service animal can utilize an Uber. But that's the 2024 Tennessee Disability Scorecard. It's a D.
Thank you so much, Jeff. I always enjoy hearing you speak. I see you in most of the trainings that I attend, and I always look forward to it when you're giving information. This has been absolutely fantastic today, and I really appreciate the detail that you went in. And for everybody else, you have all three of these documents, including the really thick full report sitting in your email. So if you do, after the meeting, go through this with a fine-tooth comb and have questions for Jeff, I believe that he had put his contact information above in the chat. Otherwise, you can get me the questions and I can send it to him. But did anyone have any questions for him?
This is Cook. Not really a question, just a comment. I really appreciate the coalitions doing this scorecard. And because I know it's not easy to gather all this information, but to have it all in one location so that we can just kind of get that snapshot. We work on different things depending on where you are in the state or what agency or government you're involved in. And so it's really important how to see with the grade. And I trust the Disability Coalition, to put information out there that's factual and data-based. So it's sort of sickening and angering in some ways, but we need that snapshot to see where we can individually work to do better. So thank the coalition for that. And thank you for always making even unfortunate news entertaining and making us want to listen to it, Jeff. We appreciate you.
It's my pleasure. I enjoy putting this one together. It's motivating in a weird, unmotivating time of the year. But Stephanie, that is a great, I got one plug. Disability Day on the Hill. It's a great time to utilize the scorecard to find something you really care about or a policy you want to see put in place, and come on down and tell your legislator about it. It's March 12th this year. The night before, we have the community party at Fat Bottom Brewing. And then March 12th is also Disability Advocacy Day. We got them on the same day this year. So registration will come out soon. It'll be on our website. We'll send out stuff. I hope to see you there.
This is Simmons. Nice presentation, Jeff, and thanks for being here.
Yes,
My
sir.
pleasure.
Thank you very
Thanks for
much
having
for
me.
presenting. This is Maddie. I
Linda
believe
left
next.
already. I want to thank her too.
So I believe next we have Mr. Kane speaking.
Hey everyone, I'm just gonna try to share real quick, so hang on with me. Okay, so are you seeing my screen now?
Yes.
So I guess for my advocacy 5 minutes, I just wanted to stick to my guns and talk about Social Security disability. It's a very brief overview of just the two types of Social Security disability. It would take me hours to cover as much as I wanted to. It's already 20-something slides, and we're just going to try to fly through it to keep on schedule. But some of the terms might be out of date, and they're used by the administration. So if you see anything like that, it's just what they use in their statutes. But the two types are SSDI and SSI. I'm sure a lot of you have heard of them. The main differences are SSDI is based on your work history, and you get Medicare from it. SSI is based on financial need and disability, and you get Medicaid, and you're immediately eligible for Medicaid. So for SSDI, you have to wait the 24-month waiting period for your Medicare to kick in. And you have to wait, I think, around 5 months. Yeah, it says 5 months for your cash benefits to start after you're approved based on your work history and disability. Some other things with SSI as well is after you're approved for eligibility, they keep track of your income and assets, which can affect your payments, unlike with SSDI. So who's eligible? People for SSI, I believe I got Zoom all over my screen, but it's people with limited income and resources who are blind at any age or disabled at any age or age 65 or older. The reason someone age 65 or older would want to get SSI is maybe they didn't work a whole lot during their life, so they can't qualify for SSDI, or their retirement isn't a whole lot, so the small amount you get on SSI might be more, and it's $963, at least it was last year, per month. So that's people who can get SSI. Geez, I wish I could see it, but I believe it's talking about the definitions of disability under SSI, or the Social Security disability. So we have a child and adult. A child is just anyone under age 18 or under age 22 still attending school, who may be considered disabled if they have a medically determinable physical or mental impairment. And that includes an emotional or learning impairment that results in a marked and severe functional limitation and can be expected to result in death, or has lasted or can be expected to last for not less than 12 months. We have some examples below that. The way a judge or a disability services examiner would examine a child applying is they would look at how those impairments, which have objective medical evidence, how those impairments prevent that child from keeping up with their peers in certain categories in terms of learning, or if they can't go play on the playground, if they can't keep up in sports, things like that. And with an adult, it's somewhat the same. It's if you have a medically determinable physical or mental impairment, and it can be expected to result in death or last 12 months. And it results in that person's inability to do work or substantial gainful activity. And I don't believe it's 1350 anymore. I think it's a little bit higher than that. But that's just kind of the cutoff for how much they can earn or earn up to until before they're considered that they can work. So if you can't earn up to that amount, let's say you had some part-time work, you could still get SSDI. And your impairments could still be considered to prevent you from working in the national economy. Let's see. How income affects the SSI benefits. So I already spoke about this a little bit. SSI benefits are based on need. So it is for those of low income and assets. Income is any item the individual receives, and that could be in-kind income, which is food and shelter, and that could lower someone's benefit by a third. That includes unearned income, which would be certain other government benefits that you're receiving per month. Deemed income, which for a child, that could be your parents' income could be deemed to you, or your spouse's income could be deemed to you, and all of those could lower your benefit as well. We have limited income. For a single person, generally that's up to $13.50 per month, depending on the income type. Again, I think it's higher than that now. Earned income is money earned from work/wages. Unearned income is any income other than wages or earning from work or employment. In-kind, food and shelter, deemed, and I already explained that. So how income is counted for SSI. Social Security does not count all income when determining how much a person will receive under SSI each month. They apply some exclusions first, so they'll give you a $20 and $65 exclusion first, and then they'll cut off half of your earned income, and then they'll subtract that from what's called the federal benefit rate. So if, let's say, someone was receiving 963 in SSI, they'll automatically get that 85 taken off, any income they earn, and then they'll subtract half of that income. So you could work a little bit part-time and still increase how much you're bringing in per month without it affecting your SSI too much. We have resources that might be counted if you're an SSI recipient. And you can only have up to $2,000 in resources, excluding things like your home or one family vehicles. So if you're receiving SSI, a lot of people run into issues where they'll get kicked off because they save up for a dental procedure, or they add themselves to a family member's bank account who may need help, or anything like that. So these are some of the things that Social Security would count as resources: land, personal property, life insurance up to a certain amount is counted or not counted. So you could have $1,500 in certain life insurance policies, automobiles besides the one you use, and anything that could be converted into cash. And again, I already spoke about that. Limited resources, individual, it's $2,000, and resources couples, it's $3,000. And if the person's resources are over that allowable limit on the first of each month, the benefits won't be paid. If the excess resources are sold, transferred, or spent, then the person could receive their benefits again at the beginning of the month. We already talked a little bit about excluded resources. Again, life insurance policies with a combined value of $1,500 or less, burial funds for you and your spouse, each at $1,500 or less, the one vehicle, the home. They generally don't count your personal property, even though they could, such as your wedding ring. I have seen some scenarios where, someone built a homemade plane at home just out of scrap they had in their barn, and that ended up being counted as a vehicle against them. So there is a line where, if you're making things at a certain point, they might be counted as resources, but generally personal property won't be. SSDI, again, this is the one based on your work history, and you can receive a range per month based on how much you have worked. So who's eligible to receive it? You have to meet two different earnings tests, a recent work test based on your age at the time you became disabled, and a duration of work test to show that you worked. Generally what you need are things called quarters of coverage. So you have to have enough quarters of coverage to apply for SSDI. And that's just based off how much you earn per year, pretty much. And you have to have medical proof of your disability. See, here's the quarters of coverage. It's got 2022 numbers on there, but it was 1,510 in earnings to get one quarter of coverage credit. And you get a maximum of 4 per year. But you must have earned at least 20 credits in the 10 years before you became disabled to have enough credits. And we just have some more on credits. We'll skip that because I don't want to keep going too long. On SSDI, you can also get certain benefits for your family members, unlike SSI. So your spouse could get some and your children some. We have SSDI and Medicare. Again, there's that 24-month waiting period. You can apply online over the phone. You could walk into the field office with an application. The attorney who had my position before I did would take big stacks of paper and walk in and just file them straight at the office the old-fashioned way. And this is just a general recap again about the two different Social Security disability benefits you can receive. And that's pretty much all I have. But I just wanted to spread the word about those two available resources and just generally just maybe imprint in your mind the differences between the two in case anyone comes in a scenario that they might need to receive those.
This is Cook. That was very informative. I knew the difference between SSI and SSDI, but I didn't know several of the details that you shared. And we get calls sometimes, people want to know why they ain't got their check yet. And, so we have to explain that that's the federal government and the Social Security Administration. So, but this is a really good reference. So I appreciate the info. You've educated us on this.
Yeah, and that made me think of one last thing I'll share about SSDI. It's that you can start working. I would keep the administration informed because it makes me think about people getting kicked off. You can start working and you have kind of a 9-month grace period. And then after that, you enter something called an extended period of eligibility where you have, I believe, another 36 months where you can continue to work. And as long as you don't earn above that cap I showed you earlier, then you'll stay on there. But the 1 month you earn above the cap, they kick you off. So you get a 9-month non-consecutive period where people work, but that's what gets people kicked off. That and just general asset stuff.
This is Eldridge. My question, I've gone through this and I could speak exhaustively on it for hours and I won't bore everybody. The question is though, by state, things are different. So getting social security benefits, SSDI in particular, in Pennsylvania, there was a certain expectation, which is where I lived most of my life. In Georgia, it was a totally different animal. And so the time it took, assuming you have all the, they do their due diligence. And so you have all the T's crossed and everything. That was rather remarkably good. Now, in Tennessee, assuming the person has their ducks in a row, meaning they have worked the appropriate number of quarters, they have shown clearly that they have a disability that prevents them from continuing gainful employment in a manner like they had been. And then, of course, the assumption that it's not the proven capability that it's not going to continue or it's not going to go away. Question is, how long the kind of person applies, if you will, through the state of Tennessee? How long does it take normally for somebody to go from, asking for an issue till it actually could be approved and executed? I mean, there, of course, is a grace period, and we all know those kind of things. What is the Tennessee? What is the expectation? What is the wait time, if you will?
It could be specific to your condition. So if you had what's called a compassionate condition, or I believe it's compassionate listing, something like that. I'm blanking. You could get approved pretty quickly, but that's because it would be a listed condition where they're kind of going to automatically approve you as long as your financial aspect is in order. Let's say you have some sort of mental health condition that is interfering with your ability to work, and you've been going to Cherokee or Peninsula or all these providers that are typically Medicaid covered providers. You apply, it's going to take 3 to 4 months probably for it to work its way through the local office, maybe a couple extra months to go through DDS. Let's say you get, so that's maybe around 6 months to a decision from the local office. If you get denied there, it could take another 6 to 7 months to work its way through the hearing office to get a decision from a judge. You know, if you're approved there for SSD, you get the 5 month waiting period after that. SSI, you're going to get them almost immediately. They still got to do some stuff for a month. But let's say you're denied there, then you got to go to the appeals council, and that's 240 days on average to get a response from them. So it can take a significant amount of time. I have cases open from 2018, 2017 that are still working their way through the system just because of appeals and things like that. But if everything goes well, I want to say 5 to 6 months. If you got to go before a judge, I want to say maybe a year and a couple months. Still a long amount of time to have to wait.
Thanks.
Hey, Jackson, this is Spangler. Trial work period months. You've got 9 of those in which you can use. They don't always have to run consecutively. You'll only use a trial work period month. For 2025, the amount is $1,160. So you can work like say you work January, February, and March. January, you make $800. February, you make $900. March, you make $1,300. You've only used one of those trial work periods, even though you've worked 3 months. And then SGA for 2025 is $1,620 for a non-blind individual and $2,700 for a blind individual.
Gotcha. And that's exactly correct about the trial work period. Thank you for mentioning that.
Now, you should come to one of my presentations.
I'd love to.
I will send you a link.
Does anyone else have any questions? This is Maddie. Alrighty, moving on to committee reports. Misha?
Thank you. Bylaws does not have anything on the schedule right now. Membership will meet February 5th. Transportation will meet February 10th. For strategic plan reports, livability did not meet because it was supposed to on January 1st, and we were all having a holiday. Universal Design met on January 6th briefly. However, we did dismiss at 15 after because we did not have enough members there. And that concludes the committee and strategic plan reports.
Alrighty. Does anyone have any new business? I will take that as a no then. Misha, do you have any announcements or anything?
I don't. I'm not sure if anyone else does.
Does anybody have any announcements? I'll take that as a no. Then if that is all, I don't think we have
Public
anything
forum.
else. Public forum, sorry. Is there anyone who would like to say anything in the public forum? And I will take that as a no as well. So if we would, we'll go ahead and move to adjournment. Can I get a motion to adjourn in a second, please?
Eldridge, I'll move to adjourn.
Thank you. In a second.
This is Spangler. I'll second.
Thank you, ma'am. Then officially we are adjourned. Thank you all very much for being here. Misha, I think the next meeting is February 12th.
We didn't do the all in favor, any
Oh, sorry.
opposed.
Aye. All in favor of adjournment?
Aye.
Aye.
Any opposed? Thank you. We are officially adjourned now.
And the time is 4:20.